So, 5 minutes on ketamine today.
Okay, we're going to quickly introduce each other. This is Liz Cracknell, who's an experienced nurse working with the CASUS team. CASUS stands for Cambridgeshire Children and Adolescent Substance Use Service. We work with under 18-year-olds in the Cambridgeshire area who have either concerns or harms related to the use of substances, ranging from alcohol up to very serious drug use.
And this is Dr. Dickon and Liz, our very knowledgeable consultant child and adolescent psychiatrist.
You embarrass me now.
Yeah.
Okay, 5 minutes.
Ketamine.
Ketamine. What do you think that young people who might be watching this would want to know?
What is it and where does it come from, I guess, would be...
Okay, yeah, no, okay.
That's
okay. So, ketamine is a medical drug, actually. It was developed as an anaesthetic, so that's an agent that to some extent puts people to sleep and stops their pain, in particular stops their pain. And it's mainly used by vets in the use of, so for surgery on big animals, horses, cattle, but it is also used by doctors as an anaesthetic, not very commonly because it's not as good as other anaesthetics that are available. So that's what it is. What that means is that it has quite powerful effects on, obviously, the brain, and it also has effects on the wider body that we could think a little bit about. Okay,
so the effects on the brain then, let's start there.
Okay. When people take ketamine, their experience is often of quite a profound sort of distortion of the way that they normally would sense the world. So people describe as things seeming either a very long way away or very, very close, or a different scale to how they would normally appear, which I guess the experience would be that if you've chosen to do that and you have some awareness that these things are happening because I'm under the influence of this drug, that's the sort of excitement and the kind of pleasure of that. But on the other hand, if that experience gets out of control, a lot of people would describe quite significant fear, particularly because at higher doses you can lose all power of movement. It's an anaesthetic, so effectively it's putting you to sleep. So that's the experience.
Okay, so you talk then about kind of losing the power to move, but are you aware of that, or are you asleep?
No, people describe being aware of that, and this is one of the difficulties that we've had working with young people in the Cambridgeshire area, and no different from young people elsewhere, I'm guessing, which is that in what's called the K-hole, where you're strongly affected by the ketamine, you don't have the power to move, but you're aware of things happening to you. Now, the problem is that often these substances are used in places and settings where there are other people around, parties, and if you are unable to move, you're pretty vulnerable. And so young people that we've worked with have been quite traumatised, some of them, by this experience of leaving themselves very vulnerable to people taking advantage of them.
Yeah. Okay, so you know exactly what's going on, but you're not able to move to make what's going on stop.
Yeah, yeah, or speak. Yeah.
Okay.
Yeah.
So you're not actually able to say
no.
No.
No. So that's quite. I mean, that's one of the anxieties. There are other kind of medical concerns about the use of ketamine. I mean, it's an anaesthetic. These are not minor. These are not minor drugs. These are major drugs that, you know, if you wanted to perform a major operation on a horse, you would use ketamine. It kind of goes without saying that you're taking risks taking a drug as strong as that. There are very great concerns about its effect on the kind of circulation and the heart, the heart's capacity to keep beating in a regular way. And there are increasingly reports, which is quite a new thing, but hearing from a lot of different places reports of people getting into big trouble with their bladder. Quite why ketamine is affecting the bladder, I think just beginning to work on that, but we've worked with some young people, and there are many reports around the country and more internationally of people having bleeding from their bladder, so bleeding when they pass water, clots, and potentially damage to their bladder that actually can't be repaired. Even if you stop the ketamine, it's the damage is done. So, you know, effectively, if I'm putting it bluntly, there are some reports of people ending up having to have a bag that they...
So basically a tube that's going up there to let the urine out.
Yeah.
Otherwise it's not going to...
Yeah.
Okay. Well, that's our 5 minutes.
Doesn't
We're
sound
slightly
like
over 5 minutes, in fact.
Yeah. Okay.
Thank you very much for watching.
Thanks.